Good afternoon, everyone, and welcome to the first event on the agenda of the 2020 Canadian Science Policy Conference. Bien que nous nous réunissions dans les circonstances différentes de ce qu'on aurait pu imaginer au début de 2020, c'est merveilleux d'être ici entre amis et collègues. Je voudrais tout d'abord souligner que nous accueillons cette réunion sur le territoire traditionnel non cédé au peuple algonquin Anishinaabe, dont la relation historique avec la terre se poursuit encore aujourd'hui. It goes without saying that COVID-19 has changed all of our lives, the ways we live, the way we work, and the ways we support our families, friends, and communities. In Canada and around the world, the COVID-19 pandemic has been a great revealer of persistent health and social inequities. The virus and its knock-on social and economic impacts are felt most acutely by people and communities who are most marginalized. The global pandemic has also highlighted how important investments in science, innovation, and research are. The Canadian science community has mobilized quickly to contribute to global efforts to understand the SARS-CoV-2 virus, to develop diagnostics, therapeutics, and vaccines, and to implement public health policies and solutions to protect citizens from COVID-19 and the downstream health and social consequences of our collective response. Science also represents the world's best chance for recovering better from the COVID-19 crisis. As societies face the difficult task of addressing the social and economic impacts of the pandemic, the power of science can inform transformation to a more equitable, resilient, and sustainable future. As part of the Government of Canada's contributions to the global 19 recovery, the Canadian Institutes of Health Research led a 10-week participatory process to develop a research roadmap for the COVID-19 recovery. At the invitation of UN Deputy Secretary General Amina Mohammed, this process engaged more than 250 experts from around the world to develop a roadmap on how science and the global science community can inform national and international recovery plans. We were proud to steward this process and fortunate to be able to work closely with partners across the Government of Canada, the United Nations, and around the world. A whole of government effort, the work benefited from contributions from the Natural Sciences and Engineering Research Council, the Social Sciences and Humanities Research Council, the International Development Research Centre, and Grand Challenges Canada, as well as from guidance from Global Affairs Canada, the Office of International Affairs, the Public Health Agency of Canada, and the Canadian Foundation for Innovation. While the roadmap is not yet released publicly, we are happy to have an early opportunity to discuss the work that went into developing the research roadmap and to speak about some of the key science policy challenges and opportunities that the COVID-19 recovery presents. Today's session will begin with a short presentation on the UN research roadmap for the COVID-19 recovery, followed by a panel discussion with leaders from the Social Sciences and Humanities Research Council, the International Development Research Centre, the Sao Paulo Research Foundation, and the United Nations Development Office. There will be plenty of opportunity for questions at the end, and we encourage you to submit your questions using the online platform. For background on the UN research roadmap for the COVID-19 recovery, I will now hand it over to Dr. Marisa Creatore. Dr. Creatore is the Associate Scientific Director of the CIHR Institute of Population and Public Health. Marisa holds a PhD in epidemiology and has a background in applied public health, health equity, knowledge translation, and developing population health tools. She is also an assistant professor at the Dalla Lana School of Public Health at the University of Toronto. Prior to joining CIHR, Dr. Creatore was the Director of Research and Analytics at Blue Dot, a startup health technology company in Toronto, where she led projects working with organizations such as the U.S. Centers for Disease Control, the World Health Organization, and the Association of Southeast Asian Nations on developing evidence-based solutions to tackle infectious disease outbreaks, including the 2014 Ebola outbreak. And with that, I'll turn it over to you now, Marisa.
Thank you very much, Tammy. I actually was, I dropped off for a moment, so I just want to double check that I can be heard again. Can everybody hear me?
I can hear you.
Perfect. Yes. Thank you. I had to log back in. So thank you very much for the introduction, and thank you to the organizers of this event for giving us an opportunity to present on this recently completed work. As Tammy indicated, I want to acknowledge that this work really represents the efforts of an entire team at CIHR, as well as many of our partners that Tammy mentioned in her remarks. So thank you for that. I do want to spend a few minutes giving a little bit of background to, sorry, I'm trying to advance forward. There we go. I'd like to spend a couple of minutes just giving some background on the genesis of this report, but then also talking a little bit about our process, and then of course jumping into some of the main findings. I do also want to flag that as of today, it has not actually yet been published. So this is a little bit of a sneak peek of a report that should be published imminently on the UN website. So as we all know, and Tammy mentioned also in her opening remarks, COVID has really had many far-reaching consequences. It's not just a biological, but it's a social phenomenon as well, affecting almost all sectors of society, and as Tammy mentioned, particularly impacting the most vulnerable populations, as well as putting a spotlight on unsustainable practices. While most of the early funded research was biomedical, as is sort of seen on the left hand of this slide, targeted research funding on the non-health impacts was a little bit slower to flow. We know, however, that these non-medical factors, as represented in the image on the right, will have massive and lasting impacts on society, especially if we maintain hope of achieving the Sustainable Development Goals by the 2030 date. So, in April, the UN Development System published a framework for the immediate socioeconomic response to COVID-19 as a response to the UN Secretary General Antonio Guterres' call to action in support of an integrated, coordinated global response to the COVID-19 pandemic. This framework provided a strategy for a robust socioeconomic recovery from the pandemic, focusing on key actions across 5 pillars, represented here on the slide. So these were health systems and services, social protection and basic services, economic response and recovery, macroeconomic response and multilateral collaboration, and social cohesion and community resilience. One of the take-home messages of that UN report, published in April, and a message that we've been hearing continuously, is that while COVID-19 has highlighted societal fragilities and inequities, it's also presenting us with an opportunity to work together and to implement transformative changes. While working towards societal recovery from COVID-19 provides this opportunity for transformative change needed to achieve a better future envisioned by the SDGs, the issue is that we don't have the answers as to how to achieve this and ensure that we don't just fall back into the status quo. And this is where the research roadmap that we're talking about today comes in, to identify those critical questions that research and science can help answer and allow us to make those transformative changes based on the best evidence. Due to similar work that we were already doing and the expertise of our Institute director, Dr. Stephen Hoffman, we were asked by the UN to lead this process, which ended up being a very rapid 10-week process to develop this research roadmap. So as Tammy again alluded to, we undertook an intensive process engaging with hundreds of people from all over the world to collaborate with us to identify key knowledge gaps that will help us recover better from COVID-19. And again, we structured these activities and these knowledge gaps around the 5 pillars that were identified in the UN report. We struck 5 steering groups, we commissioned 5 scoping reviews, 1 on each pillar, and we conducted key informant interviews, engaging more than 250 experts, as well as conducting virtual consultations. Following this widespread engagement with researchers, funders, government policymakers, and civil society leaders, as well as UN officials around the world, we ensured a balanced voice from the global north and south to come up with our final research roadmap results. So the result of this 10-week process was that we identified 25 key priority areas for research. And then within those 25 key priority areas, we identified sub-questions that were really addressing some key areas of specific gaps and specific implementation questions to achieve those priority results. But basically, all of these questions together were in service of answering the one top research priority, which is how can COVID-19 socioeconomic recovery efforts be purposefully designed to stimulate equity, resilience, sustainability, and progress towards the SDGs. As I mentioned, these 25 high-level priority areas were further broken down to examine these specific pressing questions, considering issues such as temporal urgency, cost, local context, as well as considerations of equity, sustainability, and resilience. I'm not going to go through all of these 25 questions or go into the sub-questions, but on your screen right now is just an example of how the results of this consultation and how the roadmap was laid out. As you can see, we identify a main priority question, and within the scope of that priority question, there's some key sub-questions and then some information around the relevance, the importance, and some key considerations which take into consideration issues such as local context, sustainability, etc. So, apart from these 25 priority areas and the sub-questions, we also, through this 10-week process, learned a great deal about specific challenges around knowledge gaps that were the main foci of the consultations related, that were the main foci of the roadmap. But there are also a number of higher level principles that came out of this work and these consultations that actually became evident that we felt were relevant to share, and perhaps for today's discussion are actually more aligned with the conversation. One is that equity, sustainability, and resilience must actually all be at the forefront of recovery together. If we don't focus on these concepts and we don't focus on all 3 simultaneously, then we risk promoting the status quo. There was also a clear theme of interdependence that emerged from this work, which shows how we as individuals, societies, and generations are all linked, emphasizing the need to take a holistic systems approach to research and research funding. This even touches on the idea of complexity science, concerned with the fact that complex systems and problems are dynamic, unpredictable, and multidimensional. This also led us to some other key learnings that came out of this process directly related to science strategies, and that responses also need to be cultivated within research systems, processes, and practices. For instance, research and the solutions they support need to be cultivated within the research ecosystems that they lie in. Another strong insight that came from the process we undertook was that active strategies are needed. We identified 5 science strategies that are necessary for recovery priorities to be acted on. For one, data infrastructure, we need to invest further in this. We need to bolster and support the ability for us to do almost real-time data analysis, and the need for disaggregatable data has become really evident throughout this COVID-19 crisis. We also, and this came out quite strongly in the conversations that we had and through the consultations, we need to fund more implementation science, Many of the questions that arose from our consultations were linked to implementation challenges. They were how questions, and how to ensure we don't lose sight of critical issues such as equity during the process of implementing solutions. We also need to ensure we build and support rapid learning systems that are agile and dynamic, and that we learn not just from local experiences, but we leverage the full range of global learnings that are available through the shared experience that we're going through right now. Also, as always, we have to strengthen knowledge mobilization, including training researchers how to do this better, and building the science of science, which we define here as being focused on research, how research is funded, practiced, and evaluated, and how research cultures and systems can be made more efficient, open, inclusive, and impactful. So, science of science is obviously a rapidly developing field that has very many different definitions, but when we talk about the science of science, we're referring to questions such as, how do we maximize the performance and impact of research ecosystems to ensure elements work together in a coherent, coordinated, and complementary fashion? How can we increase equity and inclusivity across the research enterprise? And how do we support systems research approaches to tackle complex challenges, among other questions? Ultimately, the commonality across these questions is that the ultimate goal of our science of science priority is to develop tools and policies that have the potential to accelerate science. So similarly, we need to unpack the research machinery and focus on all aspects of research, which includes not just the impact of different funding practices, methodological approaches, but partnership structures, advisory systems, and of course, translational strategies for different outcomes and in different contexts. So the roadmap also, of course, ends with a bit of a call to action, talking about our different roles in moving from a report to action. And of course, we're addressing actions and responsibilities related to researchers. Of course, we as the team who put together this roadmap, in some ways we had the easy job, which is to identify the questions. It's going to be up to the researchers to tackle figuring out the complex answers to these questions. We also called to action for research funding agencies to work together, not to work in silos, as is often the case, and to ensure sufficient and coordinated investment across these different priorities. And then finally, of course, a call to action to governments and civil society organizations to ask and advocate for the research that's needed to inform recovery efforts, to support it, and ultimately, of course, ensure that it is, or support the implementation of the science and institutionalize the use of the research in decision making. So finally, on this my last slide, the report isn't meant to provide all the answers. Obviously, questions are going to continuously evolve throughout this crisis. In many ways, the specific questions can be evergreen, but really, in this case, the questions themselves are less important in many ways than the highly participatory process that we engaged in to provide some basic structure and tools, and to ensure that we are all rowing in the same direction with an eye to the same outcomes and goals. So thank you very much. I'll stop there and hand it back over to Tammy.
Great. Thanks so much, Marisa, for that presentation. It's very clear that a great deal of work went into developing the UN research roadmap, and I know many of us are excited for the roadmap to be published, and then to see how it can serve to catalyze a coordinated global research response to the socio-economic challenges that COVID-19 has revealed and accentuated. I think it would be safe to say the challenges and opportunities before us are significant. And it's for that reason that I'm very pleased that we've been able to gather a distinguished panel to explore the role this research roadmap and that science can play in informing, accelerating, and sustaining recovery from COVID-19, as well as progress to the SDGs. I'm going to begin by introducing all of the panelists, and then we'll kick off probably a good half hour of discussion, ensuring that I'm protecting another good 20 plus minutes for questions from the audience at the end. So today we are joined by Dominique Charron, IDRC's Vice President of Programs and Partnerships. Dominique's a double doctor in epidemiology and veterinary medicine, and she's led IDRC's agriculture and environment program area, as well as having supervised research focused on increasing agricultural productivity and food security, reducing vulnerability to climate change, and protecting the public against infectious diseases and non-communicable diseases. Dominique participated in the UN Research Roadmap Steering Group on social cohesion and community resilience. We're also joined by Ted Hewitt, President of the Social Sciences and Humanities Research Council, or SSHRC. A leading authority on Brazil, Ted's current research focuses on national and international innovation systems, with emphasis on the roles of universities, industry, and government in promoting economic prosperity in Latin America and beyond. Ted co-chaired with the president of Fiocruz, the UN Research Roadmap Steering Group on Economic Response and Recovery. We're also joined by Luiz Mello, Scientific Director of the Sao Paulo Research Foundation, a public foundation with the mission to support research projects in higher education and research institutions in all fields of knowledge. Luiz graduated in medicine from the Federal University of Sao Paulo. He has a master's degree and a PhD in molecular biology. Luiz participated in the UN Research Roadmap Steering Group on social protection and basic services. And last but not least, Christian Salazar Volkmann. Christian was served in a number of roles at the United Nations, including as UN Resident Coordinator, UNDP Representative for El Salvador, Belize, as well as UNICEF Headquarters Program Division Deputy Director. He's currently Regional Director for Latin America and the Caribbean, UN Development Coordination Office, my apologies. In this role, Christian led the development of the UN's framework for the immediate socioeconomic response to COVID-19, to which the UN Research Roadmap responds. And I should note that it's a national holiday in Panama, where Christian is based, but he has nonetheless agreed to join us with this conversation. So welcome to all of the panelists, and maybe with that, let's jump in. So to start things off, question number one, and I'm going to turn to Luiz to answer this one first. So the impacts of COVID-19 are wide-reaching and are affecting communities in the immediate and in the long term. How can research funding organizations and policymakers balance their attention to address both the immediate and the long-term research and policy impacts of COVID-19? So Luiz, over to you.
Thank you, Tammy. I would like to thank the Canadian Science Policy Conference for inviting me to speak on behalf of FAPES. And I will begin by borrowing a word by Ted Hewitt on a previous event. And the question is, a number of our agencies actually were quite keen on fostering the development of rapid solutions. So we at the Sao Paulo Research Foundation launched a call for proposals, which in 4 days was able to, between launching the initiative, approve the first proposal. So we're quite agile in doing what we should do and foster and fund research. However, most of the research proposals we did receive were actually long-term. They were either mid or long-term. They were not a rapid response. So from our perspective, what might be lacking is a sense of urgency and is, as mentioned by Marisa on her words, a stronger sense of implementation science to get a gathering of the knowledge that's already available and how to make it more readily available to society at large. So the divide between a longer term or a rapid action seems to be not necessarily on fostering the long term, because that's mostly what scientists usually would do, and they would try to provide the best available and stronger evidence, but rather to advance with already sufficient evidence, which is maybe enough as we all look to the vaccine scene. So when enough evidence is made available, then we should go on and make it available to the public or to society at large. So that's how I would frame it.
Terrific. Thanks very much. And again, just a wonderful example there of just how quickly the community's mobilized, kind of getting out of the starting gate, if you will, but a recognition that research takes time, but that again, pointing to that knowledge mobilization plank mentioned by Marisa, how important it is to take the evidence as it's coming to light, incorporate it into decision making, so that it's immediately having an impact, and then a recognition of what still needs to happen. So thank you for setting us off here on a very good footing, Luiz. I do wonder if any of other panelists have anything to add to this particular question related to, again, the importance of balancing the rapid action with the longer term vision here. And I guess I'll just look maybe to see if anyone wants to put up their hand, getting familiar with the platform. Okay, so that's terrific. Luiz, you get the last word on that one. But I do have many other questions, and I will go to that next question right now. Might signal to Ted that this one will start with you. Ted, so many of the research priorities outlined in the research roadmap require global collaboration and interdisciplinary research. What lessons about global scientific collaboration have we learned from the pandemic so far? And how can the UN Research Roadmap guide research funding organizations and others in supporting the collaboration necessary to tackle this socioeconomic recovery? So collaboration and interdisciplinary research, Ted, over to you.
Sure, thanks, Tammy. And I want to indicate that I'm going to be speaking primarily in English, but more than happy to take questions either directly or in the chat in English and French. Mais je pourrais indiquer pour commencer que c'est un grand plaisir de participer à cet événement aujourd'hui. Et je tiens tout particulièrement à saluer Stephen Hoffman, des IDRC, qui a joué un rôle essentiel dans la coordination de cet effort mondial pour créer la feuille de route. So it was a great pleasure for me to be able to participate in something with such an impact that involves so many esteemed colleagues from all over the world. So really looking forward to this discussion today. So let me take the question in the two parts as you pose that, and first talk about more on the procedure or the methodologies of moving forward, and to suggest first off that the roadmap itself and the process itself, I think, indicated very clearly that no research body or country can really go it alone in addressing the myriad challenges facing countries during the times of a global crisis. I think that's really evident. We need that collaboration across sectors. We need collaboration across countries. as we lay the groundwork for a global recovery that's affected really everybody. Now, that doesn't mean to say that that's easy, not at all. But the work on the UN research roadmap shows that there can often be more that unites than divides us in the international research community. We really have to work hard to look for the commonalities and the big picture understandings in which we can all locate our priorities. And when we find them and when we work on them, I think the results can really be incredible. I mean, there are other examples of where we have come together to do that. I mean, one is, I'll give one closer to home and one further away, but certainly within Canada and some of the initiatives of the Canada Research Coordinating Committee, our new Frontiers in Research Fund. It's an example of how you can develop a homegrown program that opens the doors wide to international participation. It's a $275 million program that's focusing on rapid response and high-risk research, interdisciplinary research, international research. It is open completely to international co-applicants. So you can apply, one researcher from South Africa, one researcher from Canada, one researcher from Brazil. One approach, one peer review. When these projects are funded, the money can be moved to wherever it's needed to conduct the project. No double jeopardy, no waiting for other agencies to jump on board, which we hope they will. But it's a great way to get projects moving quickly. If you look further afield, for example, global partnerships associated with Horizon 2020, soon to be Horizon Europe. Canadian research teams will be working with teams in Europe and really around the world on a number of issues organized through the EU, and that's been a long-standing opportunity. I could mention other agency-to-agency opportunities as well. SHRC has worked with FAPESP and Canadian agencies and those in Europe on something called the Transatlantic Platform, which is a great way particularly to mobilize social science research in support of broad issues that cross national boundaries, and there are a number of others. And whether they're longer lasting or they're more ad hoc, these are great ways to get agencies working together. Now, on the second part of the question, in terms of how we support collaboration necessary to tackle the socio-economic recovery, the roadmap really guides research funding organizations in a few key ways, and I think that's its real benefit and impact. The most pressing research questions identified under the 5 pillars, which were mentioned earlier: health systems, social protection, economic response, macroeconomic response, multilateral collaboration, social cohesion, are really central to the direction, to setting the direction and supporting the collaboration among international funding agencies. They're paying attention. I just had a note yesterday from Europe asking where it is, when will it be ready, when can we have access to it? And I think that's really important because they're now waiting to see what the content will be so that we can start coordinating on that. In the Economic Response and Recovery Group, we had some incredible discussions, really diving down, zeroing in on issues like protecting jobs, small and medium-sized enterprises, vulnerable populations, vulnerable workers in the informal economy, and so forth. And this really helps us as agencies to think about the specific issues and ways that people are being affected to kind of direct our funding and guide our researchers to support. Linking them to the SDGs also gives it the nice sort of global chapeau and a real raison d'etre for the initiative in ways that can immediately link to global priorities. A third way the roadmap supports our work as funding agencies is by enforcing and reinforcing the critical role of social sciences and humanities, which I won't say tends to get lost in the discussion, but sometimes isn't as much front and center in the discussion as really they should be, and the roadmap certainly helped to put the social sciences and humanities back in the fore. We talk a lot about vaccines, we talk about treatment, but we need to think about people. At the end of the day, right now, combating the disease, the recovery is really about people. It's about behavior, it's about economic policy, it's about social policy, it's about economies, and of course our disciplines are critically important in that regard, and the roadmap has been essential in reminding all of us, from all of our agencies, of how we need to work together. So Tammy, je vais terminer là, et je suis prêt à répondre aux questions et participer à la discussion à ce point. Merci. Thank you.
Merci, Ted, and that was terrific. In particular, just noting again the pent-up demand, if you will, from research funders from around the world, waiting to see what the roadmap says, because we want to use that as a hook in. So, again, we were anxiously, optimistic that we might be able to share the big reveal today, but again, it will be coming very, very shortly. I will pause again here just to see if any of our fellow panelists wanted to add on to Ted's comments there about the importance of global scientific collaboration as well as the interdisciplinary approach. I'll look for any kind of hand signals. Certainly recognize we do have other questions in case people wanted to wait for those. Oh, Dominique, please go right ahead.
Thanks, Tammy. And I think and it's a pleasure to be here. Donc, bonjour tout le monde, Dominique Charron du Centre de recherche pour le développement international. J'aimerais intervenir en français pour ajouter un peu de diversité. Il y a vraiment, je crois, des très bons exemples dans le contexte des réponses aux urgences de santé publique, de coordination entre les organismes de financement de recherche. Par exemple, la plateforme GLOPID-R, GLOPID-R Research Platform, qui réunit les bailleurs de recherche en santé publique avec certains bailleurs et organismes de financement de recherche pour le développement, tels le CRDI, et dans lequel les IDRC et le CRDI participent, pour coordonner les investissements de recherche et les opportunités de recherche en matière de santé. On n'a pas un mécanisme semblable, que ce soit dans un contexte d'urgence comme la pandémie ou même en temps normaux, disons, de coordination, de collaboration à travers les autres disciplines ou même santé et autres. Donc, ce serait peut-être une opportunité de réfléchir à comment on pourrait construire sur les apprentissages de la plateforme GLOPID-R pour voir comment on peut collaborer de manière interdisciplinaire encore plus. Donc, je vais m'arrêter là parce que j'aurai l'occasion de revenir. Merci.
Merci, Dominique, and I'm very pleased that you mentioned GLOPID-R there as well. So again, lots of good global connections there, active work to ensure not only awareness of the work being done, being funded by many of us, but also opportunities for those funded works, funded projects to be collaborative in nature. So again, thanks very much. Luiz, did I see your hand move there? Did you want to get in on this question? No, okay, perfect. Again, no problem at all. So perhaps with that, keeping an eye on our time, I will go to question number 3, which is for Christian to tackle this one first. And so this one starts out by noting the development of the research roadmap included feedback from policymakers and implementers, so the end users of the research, to ensure that the research priorities reflected the recovery needs of on-the-ground decision makers. So how can we ensure that the early lessons from the COVID-19 response and recovery inform future decisions and program design? So I'll turn that mic over to you now, Christian.
Thanks very much. Can you hear me well? Super. No, thanks so much for having me, Tammy. Marisa, Steve, for inviting me to participate in this important science policy conference. It's a real honor, pleasure. It's true, it's Independence Day today in Panama, from where I'm speaking, but it's a working day, unfortunately, not just because of the nice moment to be with you. We have a massive hurricane landfall right now in Nicaragua and Honduras, and so the teams are on the ground, we're coordinating, and it kind of makes you so sad to, these two countries with Haiti are among the poorest in our region, and on top the landfall is in the poorest areas of those poorest countries. And all of this on top of COVID-19 and the theme we're discussing today, the socio-economic impact. So sometimes you don't know where to start, but anyway, these are these days today where every day something is happening where you say, oh my God, I can't believe it. So let me turn to your question and in fact, maybe point out three topics. First, on the socioeconomic response framework itself, it's a reference document. Marisa did present briefly what it's about. But we know today more even than we were developing the socioeconomic response framework, that the socioeconomic impact of COVID-19 in the world will be dramatic and that it will be long-term. Especially Latin America and the Caribbean will be hard hit, but actually everywhere. So this situation now changes the environment for the realization of the Sustainable Development Goals fundamentally. And the negative effects that Marisa showed a slide on the effects that it has in the different SDGs, it can really cause a massive setback in the implementation of Agenda 2030. Against this background, this framework represents really a first line of defense to prevent such reversal from occurring. It's an emergency package. That's why I like Luiz, talking about we need to move faster. This is an emergency package for development policies and program that we put together based on the experience with the Ebola crisis and the global financial crisis 2007-2008 essentially. And so the research roadmap based on this framework is actually, as you said, Tammy, grounded in field experience. So its main lines of research will be and are expected to be highly relevant for decision makers. So that's one thing. The second thing is about the relevance now of the short-term research, of the faster research. So I just want to share what I'm hearing from the practitioners on the ground right now. Where is the big demand? And there's so many, so I can't mention them all. But in terms of early lessons from the pandemic that you asked for, there's a number of priorities I'd like to briefly mention. First, Tammy, you also mentioned in your introduction, the key principle of the Agenda 2030 is leave no one behind, the equality, the equity issues. And so there is really a demand right now on impact of policies and programs related to COVID-19 on the most vulnerable groups in society. I think Ted also alluded to that. Impact on indigenous and Afro-descendant population, on informal workers, migrant workers, on refugees, stateless people, disabled, etc., because not just because it's the right thing to do, ethically, morally, socially, but also because all of these hard to reach population group in society, if we don't reach them well, we won't defeat the pandemic. Then a second aspect of the framework is that it has a very strong gender perspective, given the large impact that the pandemic has on women and girls. So all types of gender research, quick gender research on the impact of the pandemic will be really important right now. The sharp increases of GBV, we're seeing the strong consequences of labor on those professions, on the care economy, etc., where women constitute most workers, the impact on the LGBTI community, you name it. So there's a second big area right now where there is a lot of impact and where then therefore is a lot of demand on research. In terms of the sectors, I think Ted touched on this, so I won't really mention it, but the whole issue of continuity of social services, the social protection systems, and the microeconomics of the pandemic in terms of protecting small, medium, enterprises right now. What is effective, what's working, what's not, that will continue to be a very important, there's continue to be a lot of demand by policymakers around that. And finally, in this immediate list, social research on behavioral changes and social norms within the population, you know, whether it is to help to correct current measures taken for protection and prevention or future pandemics. And in the long run, there's a whole, because there is you made a distinction in your first question, but of course there is this link, and there's a lot of questions that decision makers have to take decisions now, having long-term topics in their mind related. This is the chance, we call it the opportunities of the crisis, to do things differently, on digitalization, on green and blue economy, on the relation between humans, animals, and the environment, on effective mechanisms of conflict prevention, for social dialogue, political consensus, etc., etc. And the third aspect on this, you know, you said what needs to be done. I think the main way to ensure a fast transfer of the research results for COVID-19 is really to bring researchers, research funders, and implementers together from the start. In a way, the research roadmap itself serves this purpose, to bring in the communities from the very onset under a similar framework. So this is really a great initiative of the Canadian Institute of Population Public Health and all the other, you know, architecture on science and policies of Canada. We're really, really grateful. I haven't seen something like that before, actually, that in response of such a crisis at the global level, there would be such a kind of coordinated idea of a coordinated science approach. But the roadmap needs to be operationalized. And so to operationalize it, I think first, once it's published, which we hope it will be very soon, it has to be disseminated really, really widely among the development actors, the research community, the government partners, so that policymakers, researchers, and implementers know it. Then I think it would be really useful to offer a place or a point of contact where colleagues in the field who are engaged with the implementation of the socioeconomic response plan can apply for research grants. Ideally, a focal point that can help them to direct their research proposals to where they are relevant, to where they belong, or at least to have a type of list of research funders and research institutions with a short summary of their main requirements, so people kind of have a bit of transparency where to go, because in the field, very little is known about the global or even the national or Canadian architecture around research and research funding. And then I think finally, it's important to maybe establish in some of the existing mechanisms that you have an institutional link now between the UN, between the interested research institutions and the research funding agency, where you know, we can collectively follow up on research progress, help to disseminate the knowledge generated at global, regional level. You know, you may know, you know how this could work, but we need kind of a place to dock on and to give a bit of a regular, periodic follow-up on all of this. And count on the Office for Development Coordination, the UN, for any next steps to operationalize the research map on the ground that yet also you may think are useful. So thanks very much again. Back to you.
Wonderful, a very thoughtful response, Christian, and again indicating a multi-pronged approach here. I was particularly pleased that you noted just the way that the UN Recovery Roadmap was created by engaging actors from various groups who may not typically have interacted. Often it's researchers doing their research, handing it over to those who can use it and keeping them apart. Whereas this was created by bringing people together at the same table, tackling, the problem that's in front of all of us. So I do think, the very creation, the very process we use to create the roadmap is very likely an indication of what's going to be needed in the future to make sure that this becomes a reality. So I appreciate that. Do any of our other panelists, wish to get in on this particular question as well? I am noting that we've started receiving some questions through the chat box, which is wonderful. We'll have plenty of time to tackle those. But Ted, I did see you raise your hand, so I'll turn to you right now.
Yeah, just very briefly to follow up on something that Christian had said, and that is that the funding agencies that have been involved in this exercise and others have been intensely interested in the result of this and in the publication of the report. That's awesome. The large numbers that have been involved are already communicating with each other and with government around the exercise for various reasons. I think, certainly the pride of having been associated with it and the importance of the enterprise. But also, I don't know of one agency, and I don't care where, and people that we interacted with, whether in Africa, in Latin America, North America, and Europe, usually have pretty good communications divisions and offices, where I anticipate, and they were entreated to certainly communicate their participation in the exercise and the results of the exercise, which I think will have at least initially create a very good pathway to further socializing the results. So I do expect that will happen as a very, very, very initial outcome of this.
Great, thanks, Ted, and I too agree. I couldn't have said it better myself. So maybe with that, I'll go to our another question that we've got on the docket, and this one, it's going to you first, Dominique. So just piquing your interest here. So our global science system includes researchers, research institutions, research funding agencies, regulatory bodies, academic societies, publishers, individual knowledge users, and so on. How well this system of actors works together will affect how well the science ecosystem responds to global challenges like COVID-19. So as countries are developing short and long-term strategies to deal with the pandemic, where do you see the opportunities and gaps regarding how the global science system responds to emerging challenges? So based on your perspectives, your engagement, where are the opportunities and the gaps?
Wow, that's a big question. Let me just try to highlight a couple of things, and I could come back to it, I think, in the response to the next question, so that we leave time for more questions as well. There is this idea of a global science system, but I think the global science system is, in fact, a network of systems and actors, and not a highly honed system. So absolutely, I agree with the point that it's how different stakeholders engage in science in different regions and in different disciplines or on different issues that essentially determines how we as funders respond, because we are responding to them as stakeholders. There's I think a real opportunity as funders for the funding bodies to collaborate, as I mentioned earlier, and to internationally. And there's also an opportunity, I think, within countries to play a catalytic role in bringing together actors around a particular issue, a particular discipline, or around something like interdisciplinary research in response to an emergency. And one nice example of this is IDRC works together with 17 granting councils in African countries, science granting councils, and we have a long-standing partnership with them where we're supporting and enhancing their capacity to fund high quality research. And we do that in partnership with other funders, with the UK, with Sweden, and with a tremendous amount of leadership from South Africa's National Research Foundation. And this collaboration enabled us to respond to a real demand from the research communities and stakeholders, policy and decision makers in African countries for rapid research. And by being able to capitalize on this platform, we were able to mobilize additional funding from those other funding partners to catalyze that research response. 80 or so small projects, mostly, were funded through these 17 granting councils in African countries to mobilize their communities, not only around rapid social, economic, and public health research in response to COVID, but also strengthening knowledge translation, improving science journalism so that the science was getting into the public sphere. So that's one example of how we as funders have a role in catalyzing engagement with multiple stakeholders.
Wonderful, and a wonderful example again of something that existed pre-pandemic, and it signals again the importance of thinking of this system as actually a system of systems, and kind of how to break it down rather than thinking of it as one big entity, which can become or might seem to be just overwhelming, particularly for those people who might not be familiar with the existing entities and the connections that already exist there. So that's excellent. Do any of our other panelists wish to chime in on the question that I had just posed to Marisa, to Dominique there? Marisa, you noticed I said your name because you were top of mind there. Maybe not to put you on the spot or anything, but in the work, given your proximity to pulling together the research roadmap, were Dominique's comments there, do they resonate for you based on the consultations with the 250 plus experts who were engaged?
Figuring out my unmute. Thank you for that, Tammy. And yes, no, absolutely. I mean, I think Dominique's comments were bang on, and obviously I didn't have very much time on the presentation to sort of get into it, but I think this really ties into that sort of third last slide about some of the greater strategic learning.
I mean, it's the transatlantic platform, it's joint calls, and this is basically where we're at least, you know, from the perspective of where we are at in Canada, at least. So I think this is a really great point of departure for further discussion about how we might be able to develop something on a more permanent basis or long-term basis to address some of this.
Great, thanks very much, Ted. And I think, you know, a lot of our thinking is about how can we ensure that we're learning from the circumstance that we're in right now to ensure that we're prepared for the future and not having to, you know, create de novo, you know, situations, linkages that would have been helpful if they had existed before then. Christian, I know you wanted to get in on this one, so I'll turn to you right now.
Thank you. Briefly, you know, already Agenda 2030 represented a kind of a paradigm change in how we look at development. Before, we would see with the Millennium Goals a much more sectoral approach to responses to poverty and others. But with Agenda 2030, that has already changed. The health goals, no Ministry of Health can achieve the health goals alone, just to give that example, and so on and so forth. There's hardly, in the institutional structure of policymakers, hardly any goal today that you can achieve through sectoral interventions alone. So the question is spot on. The intersectoral approach is the way to go. And if you see how governments react to the pandemic, of course, there is the health lead right now in the health response. But on the socioeconomic, they have to bring several sectors together to make sense. You have to look at education, you have to look at labor, you have to look at the economic and finance ministry. So it is in many countries an all-government approach. That means for research, where I'm standing is that really socioeconomic research on the impact of COVID needs to be intersectoral everywhere. That's not to say that you have, say, a health focus, but if you can't relate your health focus to, you know, adjacent sectors, social sectors, and their impact, you're not doing the policy makers a favor, because they're lacking, especially the know-how about these connections. Thank you.
Wonderful. Luiz, did you want to get in on this one right now, or should I circle back to you for the next one? Your choice.
It's on this one, and the suggestion we actually use down here at FAPESP, or the São Paulo Research Foundation, is that all of our grants are evaluated on an iterative basis. So there is no definite rejection of any grant proposal. All of the grant proposals can be reassessed. And in that sense, if we set for getting a greater interdisciplinarity, we could make just an initial call for proposals and see who is open to make proposals and available to interact. And then we could either force matchmaking or on this interactive mode, get them to do that if they haven't done from start. So there are a number of ways which, on the other hand, might delay somewhat the approval process, but they would, it's hard to get in both moments, complexity and speed of response. Either one would be disfavored, but that's how we see it.
Perfect. No, again, appreciate the thoughtful response here, and certainly the perspectives, you know, just knowing what works, what is working elsewhere, and having the courage to try something new. I think that's wonderful. I'm keeping an eye on the chat. So again, I just want to remind colleagues in the audience that we are keeping an active eye on the chat box, so don't feel like you can't submit a question. We still got about 15 minutes with the panelists here. I will go to one next question here, and it's an interesting question because we've been talking about how this is impacting the entire globe, how important global collaboration is here. But the question actually, it speaks to, how to ensure that local knowledge and local lessons are captured and shared. So how do we toggle, or how do we balance, what happens locally, what lessons have been learned, and how does it, coordinate or connect in to the global response? Dominique, I wonder if I might be able to tap you for the first response here. I suspect you've got some examples to share based on IDRC's work. So over to you.
Indeed, thanks. It's a real challenge, I think, as we think about scaling, knowledge translation in general in contexts of urgency like this, and how we scale the impact of research beyond the sort of immediate stakeholders of that research. And certainly, if we think about medical countermeasures and health research, much has been learned about how to do a better job of sharing results, of doing more open collaborative research in times of public health emergencies. We have the WHO blueprint. We have a number of mechanisms and bodies that are now, and norms, I would say, around sharing samples, around sharing DNA information and other useful aspects of collaboration in response to COVID that have arisen from hard lessons learned, I think, around, in particular, the Ebola crisis in West Africa. And there's a whole infrastructure in health research and medical countermeasures research for testing, scaling, validating, and then deploying the results of research, clinical trials being the most obvious example or element of that. It's much more challenging, I think, when we're talking about scaling research results that are arising from other types of research and even public health research that is not vaccines or medical countermeasures. And yet, this is the challenge that we face. IDRC, in the early days of the pandemic, we heard from our stakeholders in many developing countries that decision makers were banging on the door looking for knowledge, for data, for evidence, for any kind of scientific findings or good research that would help them in developing their economic response, in developing their social protection response, and trying to respond to this. All of the research that they had access to was primarily developed in industrialized countries and therefore not really meeting their needs. So we mobilized the social and economic policy research community in these countries to respond to those gaps. Now, it's very interesting because in some countries, and including in Canada, I think think tanks, independent policy research institutes may not actually be eligible for all sources of funding that are mobilized in times of crisis. And so it's I think an additional reflection that we need to make as funding organizations to consider who has the knowledge, who has the experience around knowledge translation, and who has the capacity to transform emerging data, collect data, transform it, and be able to present it to decision makers. And how do we make sure that the funding opportunities that we create mobilize both the research capacity and the knowledge translation capacity to be able to get this into the hands of researchers. And that whole process, we wound up funding 35 organizations in 42 countries. And we're working with the Institute for Development Studies in the UK to help coordinate and raise up the results to not only to meet the local decision makers' needs, but how might we share that more broadly so that those innovations in social and economic policy are do not need to be reinvented in every country.
Great, thanks, Dominique, and absolutely, I couldn't agree with you more there in terms of, learning what works elsewhere and giving it a try. No need to start from scratch. Ted, did you want to get in on this one? I'm going to signal that we have another question in on the chat box, but Ted, if you wish to jump in on this one, we've got time.
Sure. I mean, just to say that this is not unique to Social Science and Humanities Research Council of Canada, but we're increasingly funding community-based research, which is driven by local community needs. And we expect to see more of that, particularly as the word about the roadmap starts to circulate. I think there'll be much more interest in doing projects that may speak to some of the issues that were highlighted there. The most salient place that we're seeing that, though, is around Indigenous communities. And, we've adopted policies in Canada within the research agencies that prioritize Indigenous community-based research that is undertaken not on behalf of, but in direct need and directed by Indigenous communities. So to the extent that COVID-19 recovery and impact issues come to light, then I fully expect that those are going to be received and funded through not just our council, but others as well as this evolves. And the roadmap, I think, will be great in bringing these things to the fore, legitimizing them, and helping to provide a platform for communities to become more actively engaged in seeking resources through funding agencies, not just in Canada, but globally.
Great, thanks, Ted. And again, this is a terrific conversation. I think we're hitting our groove now, and it's too bad that we can't stay on the line for a little while longer. But hopefully, when the roadmap is released publicly, folks will remember this conversation. And of course, we know that there will be subsequent conversations in this regard. I do see another question in the chat box. I'm keeping an eye on the time, so I think this might be the second last question we'll be able to take before we have to jump off. And it's a really great question. Essentially, how can we measure our progress towards achieving an equitable recovery from COVID-19 that also considers the SDGs? In effect, how will we know when we're doing a good job? And maybe on this one, I'll first turn to Luiz and then to Christian to get your thoughts on, how do we measure our impact on something this big?
Thanks, Tammy. That's a great question and a great point. On all projects, when we clearly manage a project, we establish key project indicators, KPIs. And so establishing what given levels of achievement we may want to reach, it's definitely a prerequisite. We must establish them a priori, and then we're able to move forward. Again, doing research in Brazil might provide a benefit for that, and in the sense of equitable recovery. Brazil is a very unequal society. Our indicators are very poor in many senses, and COVID-19 just highlighted that. If you look to what was the contagion rate on poor neighborhoods versus rich neighborhoods, what was the mortality rate on poor neighborhoods versus on rich neighborhoods? That was a dramatic difference. And so to that end, just to try to bring whatever behavioral measures or health measures that would allow one to check whether the achievements on different neighborhoods were similar or different, would again just look to this equitable recovery and on light on some of the UN Sustainable Development Goals. So, but it's doable, and it's it's rather a question of defining early measurements that or indicators that could be used to follow up and to steer the initiative. So that's how I see it.
Wonderful. Christian, did you want to add to Luiz's thoughts there?
Yes, the socioeconomic response framework is timed 18 months. It was supposed to be, as I mentioned, emergency measure for development programs. And as we stand today, we know that there will be a process where basically our cooperation and the socioeconomic response will become the recovery response for the SDGs. It will be continue to be guided by the SDGs. So our regular measurement systems will have to be adjusted, because this world today is not the world of 2015 anymore. But there will be a process whereby what we do now will be integrated into our way how we look at and how we support countries on the SDGs. And the second aspect is that this whole thing now, because in more than 100 countries, we have done vulnerability assessments. And the issue of lack of disaggregated data is not a new one. In fact, one of the key difference between MDGs and SDGs is this commitment to try to measure impact with disaggregated data on the most vulnerable. So for us, this gives additional push to work with the National Statistical Office in the countries to improve their capacity to generate on a regular basis disaggregated data.
Great, absolutely. And so again, I might take the chair's prerogative here and maybe put each of you on the spot. We've been talking with great enthusiasm about the UN Research Recovery Roadmap, and noting that we're all, patiently or impatiently awaiting for its public sharing. But I want to know how each of your organizations intend to use the roadmap to inform its future decisions, investments, and collaborations going forward. We have only a few minutes left, but let me maybe start. I'm going to put Ted on the spot first, and then head over to Christian, Dominique, and Luiz for thoughts there. So what's your organization's intent when the rubber hits the road? Are you going to use the roadmap, and if so, how?
So thanks, Tammy, I guess, for that. But I think that in the first instance, we're going to be promoting this very much through our communications channels and to our community to try and generate a discussion around what areas we should be prioritizing and what opportunities we should be using to help to address some of these issues as we see are appropriate through this initial discussion process. There's quite a bit of excitement about it, and we want to have that discussion. The second piece will be how we use this to guide our discussions with our partners in Latin America and Brazil and Europe, Africa, and elsewhere as we develop joint funding. And there's already been one impact of this, I'll say, and that's been with our partners in the Transatlantic Platform, which offers calls every other year or so, every third year collectively. And we've already been discussing about how we can take one or more of the objectives from the roadmap and to create a call specifically oriented to that across the 15 member countries and agencies that form part of that. So I think those, in the early days, those would be our initial efforts, and that's where we'll be directing them.
Thanks, Ted. Christian, how about your organization?
Yeah, first, I'm very enthusiastic about this. I've never seen before that we had something like this, kind of a global socio-economic crisis, so to speak, and a research map attached to it. And what's now the task is how do we link those in practice? And so first, we do have in more of 100 countries right now people working on the response. And like Ted, we will disseminate this framework with them, with our staff, with the partners, with the government as much as we can. Then I think we will facilitate a meeting between Steve, Marisa, and others with what is called the technical team in New York. These are senior UN people who are coordinating the UN response to sit together and see, how can we create this link? And I think thirdly, that's more maybe a wish, a dream. I hope the government of Canada can continue to be engaged. We have a global process on development financing that is chaired by Government of Canada and Government of Jamaica to look into new ways of development financing in this new COVID world. And it could be nice to have, I don't know, a Government of Canada with, I don't know, another development nation or something leading a chapeau of friends of research that helps to kind of give the political backup to speed up this link between the world of research funding, and the implementation, the policymakers, basically. Thank you.
Perfect. Dominique, over to you.
Yes, I think I just want to echo what Christian has said and to really thank the Deputy Secretary General, Amina Mohammed, for her great idea, and to thank also Stephen Hoffman and CIHR for jumping in and taking it on under really tight timelines and running such an inclusive process, because it really does signal, I think, the way forward for us. All of the organizations that were involved in the development of this agenda and the many others now that we can rally to respond to this agenda. It creates an opportunity for that collaboration. Puis j'ajouterais aussi qu'il y a vraiment peu de limites sur combien de nouvelles collaborations qui vont pouvoir émerger. Pour moi, une question qui reste, c'est comment allons-nous réussir à partager ces collaborations pour qu'on sache qui fait quoi? Est-ce qu'il y a un besoin de créer un réseau? Est-ce qu'on capitalise sur le Global Research Council, par exemple, pour créer une plateforme où nous pouvons partager? We need some kind of way to know what the different collaborations are and how different networks of funding councils are using this and moving forward. So a call maybe for us to find a way to create a platform around this agenda to share and foster those collaborations.
Merci, Dominique. And Luiz, last word to you.
Thank you, Tammy. I will echo Ted's word. We should, as soon as the report is made available, we should disseminate it across our societies, our colleagues, discuss, see what we can come up as suggestions. And again, as already mentioned, there is this initiative, so-called transatlantic platform, that links agencies in the Americas and in Europe. We're hopefully discussing joining some African agencies as well. And that is already on discussion on that forum. And I hope we may come up with very good science, most of all understanding that there are so many unknowns on this pandemic. Why a number of countries in Asia with maybe some different habits, using masks, for instance, do not get as much contamination, and others not using masks, still in Asia, also do not get that much contamination. And so what's the biological, what's the sociological or anthropological factors that influence the outcome of this disease? We're currently having a second wave in Europe. How is this to be developed elsewhere? So again, international or global collaboration is much needed on this, and hopefully the UN roadmap will be a great element to that.
Wonderful. Thank you. Thank you to all of our presenters for joining us today and kicking off what we hope will be a continuing discussion of how the full potential of science can be rapidly harnessed to inform decision makers working to build a more equitable, resilient, and sustainable future. Thank you to colleagues at SSHRC for the invitation and collaboration necessary to put today's panel together, and to all of you who joined us online. When the roadmap is widely released, released in the coming days. You will be on the CIHR website. And I need to remind all of you, perhaps to plead with all of you, to complete the evaluation survey that will pop up at the end of today's session. It's very important to us and the conference organizers as we strive to make this even better. We hope you've enjoyed the discussion, and on behalf of all of us here, I'm wishing you all of the best. Please take good care, and bye for now.